Hello, I'm Molly. I'm a nurse practitioner student with South College, and I'll be performing an assessment on you today. Is that okay?
Yes.
Okay, I've provided privacy. I've washed my hands and I would put gloves on. Can you tell me your name?
AJ.
And where are we at right now?
Home.
And what year is it?
2026.
I've already obtained your vitals. Your blood pressure is 130/80. Your heart rate is 80, and it was sinus rhythm. Your respiratory rate is 17. Your SpO2 saturation is 99% on room air. Your temperature was 97, and we took that orally. And your height was 5'6", and your weight is 215 pounds. Okay. I'm going to start by inspecting how well groomed you are, hair distribution on the scalp and face. I'm also going to observe hygiene, and you are well groomed. And now I will touch your scalp, if that's okay.
Yes.
Okay, I would palpate the scalp, see if there's any lumps or lesions, and there are none. I would also check for any nits, which there are none. I would also palpate the skull for any lumps or masses, and there are none. Okay, lift your head up. I'm going to palpate the frontal and maxillary sinus. Any pain or tenderness?
No.
Okay. Any pain or tenderness here?
No.
Or here?
No.
Okay. If you'll keep your eyes closed, I'm going to lightly touch you with a cotton swab. If you could tell me if I'm touching your forehead, cheek, or chin, okay?
Okay. Forehead, left cheek, chin, right cheek.
Very good. I'm also going to palpate your temporal pulses for amplitude. There are 2 plus bilaterally. Okay. Next, I'm going to move on to your eyes. They're symmetrical. I see no obvious lesions or drainage. I'm also looking at your irises. No deformities there. And I will look at your conjunctiva, and they are pink. No deformities, lesions, or drainage there. Okay. You will look at my pen and follow the pen with only your eyes. Got the pen, keep looking, keep looking, keep looking. Very good. I'm going to perform the corneal light reflex test. And they are symmetrical bilaterally. And your pupils are 2 millimeters bilaterally and are equal and reactive to light and accommodation. Now perform an ophthalmoscope exam. Please look at the wall behind me, sir. And I do see the vessels of the eye, and there are no abnormalities. Continue to look at the wall behind me. And the same for this side. Vessels of the eye are within defined limits. Okay, sir, you will cover your right eye. And you want to test your peripheral vision. If you will look directly at my nose and tell me when you see my fingers wiggle.
No. No. No.
Okay, and cover the left eye. Tell me when you see them wiggle.
No. No. No.
Okay, all right, sir. Now I'll perform the scan eye exam. If you'll cover your right eye, read the smallest line that you can read.
LTFPH.
Okay, cover the left eye. And again.
LTFPH.
And now with both eyes.
LTFPH.
And that is 20/20 in both eyes. Okay, now I will move on to the ear. I'll inspect the external ear and the external canal. I do not see any lumps, masses, or drainage. Neither on this side. Ears are symmetrical. I'm going to check this tympanic membrane. The ear canal is free from any drainage. The tympanic membrane is pearly gray with adequate light reflex. And the same for this ear. Tympanic membrane is pearly gray with adequate light reflex. Any pain here?
No.
Any pain here or here?
No.
Okay. Now the test I'm going to perform, this is the Weber test. I'm going to use this instrument and place it on your head. Tell me if you hear this sound in both ears or one ear more so than the other.
Okay. Both.
Okay. This is a Renee test. I'm going to place this behind your ear. Let me know when you stop hearing the sound.
No.
Can you still hear it?
Yes.
And same for this ear.
No.
And you still hear it?
Yes.
Okay. Alright, sir, if you could turn slightly, we're going to perform something called the whisper test. I'm going to cite a series of letters and numbers, and you will repeat those back to me as you hear them, such as K78.
Okay.
Okay?
M02.
Okay, and one more.
R37.
Okay. Alright, now I'm going to look at your nose. It is symmetrical. Also going to look at your nasal mucosa. No lesions, and it is pink and symmetrical. Okay, if you'll occlude one nostril, please, and breathe in and out. And do the same for the other. Very good. Close your eyes, please, and tell me what you smell. Very good. Alright, now I'm going to take a look at your mouth. No obvious lumps, lesions, or drainage from the lips. Lips are pink and moist. Open your mouth, please. Mucosal membranes are pink and moist. Say ah.
Ah.
Uvula is midline, and tonsils are 2+. And no deviations there. Okay, now I'm going to have you clench your teeth and squint your eyes, raise your eyebrows, puff out your cheeks, and stick out your tongue. Move it side to side. Okay, very good. Thank you, sir. All right, now I'm going to move on to your neck. I'm going to look at the neck and expose the lower portion of the neck. Tilt your head back some and swallow. Okay, no abnormalities are seen there. The neck is symmetrical. I see no lesions. The trachea is midline. Carotid pulses are 2+ bilaterally. Any pain here?
No.
Any pain here?
No.
In here?
No.
Or here?
No.
Okay. Now I'm also going to feel behind you. Displace the thyroid and palpate for any nodules or lumps. There are none. And displace to the other side and palpate for any, and there are none. Okay, now I'm going to move on to your upper extremities. I'm going to check your arms for symmetry and check the skin temperature. It is warm and dry. Skin color is appropriate for ethnicity. We'll check skin turgor. Capillary refill is less than 3 seconds, and that is bilaterally, no clubbing. I'm looking also at the hair distribution, which is normal. And I palpate the brachial artery. It's 2+. And the radial is 2+. Brachial is 2+. Radial is 2+. Could you bend your arms? Out. Down. Okay, arms back out. Can you turn your hands over? Supination and pronation is intact. Tell me if you have any tingling or numbness. This is the Tunnel sign.
No.
And here?
No.
Put your hands together. Any numbness or tingling there?
No.
That is the Phelan sign. Okay. Now I'm going to have you turn sideways slightly. I'm going to look at your chest here. See for symmetry. Watch your breathing, and it is unlabored and is symmetrical when you do breathe. The anterior-posterior diameter is greater than the lateral, which is normal. I'm also going to look at the configuration of the thoracic region of your back, and it is normal. The spine is aligned, and while I'm here, I'm going to palpate your cervical areas. Any tenderness?
No.
Thoracic area? Any tenderness?
No.
In the lumbar region?
No.
Any tenderness? And your sacral region?
No.
Any tenderness? Okay. Alright, I'm also going to palpate back here. If you'll turn to the other side. And if you'll say 99.
No.
Once more.
99.
And once more.
99.
And now I'm also going to have you take a deep breath in and out. And the thoracic inspiration expiration is symmetrical. And now I'm going to percuss. If you'll lift your head up, please. Just slightly. Okay. And lift your arm, please. And that's percussing the lateral side. Now we'll percuss this lateral side. Okay. If you'll turn slightly. Okay, and we'll percuss. Okay. Now listen to your chest. Just breathe normally. And lift this arm, please. Okay, and turn once more towards the camera here. And just breathe normally. Now listen to each section through inspiration and expiration. Okay, sir? Hold your arms out for me. Don't let me press down. Don't let me press up. Don't let me press in. And don't let me press out. Okay. Shrug your shoulders. Okay. All strengths 5 out of 5. And I'm going to have you press your head against my hand. 5 out of 5. 5 out of 5. Forward. 5 out of 5. And 5 out of 5. Okay, very good. And now I'm going to have you lay down. Alright, I'm going to inspect the chest. I'm going to keep your chest covered. I would inspect the chest for any lesions or masses, and there are none. I would palpate the precordium for any pulsations. They're abnormal, and there are none. And I would listen to the heart. In the aortic, pulmonic, Erb's point, tricuspid, and mitral valve. Now use the bell at the apex and at the 4th and 5th intercostal space. I would then percuss the heart borders. I would go along the sternal border into the 2nd intercostal space and begin percussing inward. And mark the area of dullness. And then go to the 3rd intercostal space. Mark our area of dullness, and again with the 4th intercostal space. And mark the area of dullness. I'd also percuss along the right sternal border. Now I do not hear any dullness, which is normal, so the heart is more towards the left side, which is within normal limits. Okay, I'm going to expose your abdomen, sir, if that's okay?
Yes.
I'm going to inspect your abdomen with conventional lighting. See if there are any abnormal pulsations. There are none. Skin is appropriate for ethnicity. It is warm and dry. The umbilicus is midline, and the abdomen is soft. Okay, now I'm going to listen. Bowel sounds are active. I would also listen over the liver for any venous hums and listen over the spleen. And I'll use my bell over the aortic, renal, injuries. There are no abnormalities. I'm going to palpate your stomach. Let me know if you feel any tenderness or pain.
Okay.
I'm going to palpate lightly to begin with. Any pain?
No.
And now I'll palpate deeper. Any pain?
No.
Any pain here or when I let go?
No.
Negative Rossing sign. Pain here or when I let go?
No.
Negative McBurney sign. And take a deep breath in. Any pain there?
No.
Negative Murphy sign. And I would also palpate each kidney and spleen and the liver's edge. There are no abnormalities, masses, or lumps. Now percuss the liver's edge for dullness, percuss the spleen, and then percuss all 9 quadrants of the abdomen. Also perform the fluid wave test. There's no fluid on either side of the abdomen. Okay, sir, lift your leg up against my hand. Any pain?
No.
Negative psoas sign. Any pain here?
No.
Negative obturator sign. Alright, sir, you can sit up. Alright, now I'm going to take a look at your lower extremities. The skin temperature is warm and dry, inappropriate for ethnicity. The skin color is. I would palpate both femoral arteries. I would palpate your skin turgor, and it is adequate and within defined limits. I would also palpate each popliteal artery behind the knee, which is 2 plus, 2 plus. Posterior tibial pulse is 2 plus, and dorsalis pedis, which is 2 plus. And the same for the other side. And the capillary refill is less than 3 seconds. Okay. I'm going to now perform reflex test. Go ahead in your arm. I'm going to check your bicep reflex. 2 plus. Brachioradialis. 2 plus. Bicep. 2 plus, brachioradialis, 2 plus, tricep, 2 plus, tricep here, 2 plus, patellar, 2 plus, 2 plus, and now your Achilles, which are 2 plus. Okay, if you'll close your eyes, sir, and you tell me if you feel a sharp or dull sensation in your arms, hands, legs, and feet.
Sharp. Sharp. Dull. 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 Sharp. Dull. Sharp.
Okay, very good, sir. Okay, now I'm going to have you take, if you'll scoot forward just a little bit, take this heel, slide down your shin. Take this heel, do the same, slide down your shin. Very good. And if you will look directly at me, touch your nose, and touch my finger with rapid alternating movements. When I move my finger, touch my finger. Finger, nose, finger, nose, finger, nose, finger. Very good, sir. Okay, now if you'll stand up, I'm going to have you walk across the room normally. Walk back on your tippy toes. Okay, walk back on the heels of your feet. Okay, sir. Walk back normally. Knee gait is normal. Turn around. Touch your toes, please. Okay. Touch your toes, please. Spine is aligned. Okay. Any pain or tenderness here?
No.
Cervical region, thoracic,
No.
lumbar,
No.
or sacral?
No.
Okay. Lean to the side, please. To the other side. Back. And rotate. And rotate. Okay. Squat. Very good. Okay. And now put your leg out and back. Directly back. Don't bend your knee. Pull your leg backward. Like that. Yep. Okay, very good. Same with the other leg. Forward and back. And then to the side, please. And back. Okay. It's normal flexion, extension, adduction, and abduction. Okay, you can have a seat, please. And, sir, I'm going to have you push down on my hands like a gas pedal. Okay, and pull up with your toes. Okay, very good. And if you'll stand up one more time, I'm going to perform a Romberg's test. I'll have you stand here for 30 seconds and observe your balance. Then close your eyes for 30 seconds. So if you'll do that, and I would observe your balance for 30 more seconds and make sure you don't sway. And that would be a negative Romberg's test. Okay, you can have a seat. Thank you, sir. That concludes our exam.